Diabetic neuropathy is one of the complications of diabetes, long-standing diabetes especially. If the sugars are uncontrolled or the diabetes is there since long period of time, then it affects the nerves, especially the peripheral nerves, nerves of the lower limbs or upper limbs are affected. And after the affection of the nerves, then there is a complaints, various complaints starts like tingling sensation, burning sensation, some stabbing sensation. Okay, in some patients they even feel that they are walking on the cotton wool. So these are the symptoms of the diabetic neuropathy. Usually the diagnosis of diabetic neuropathy is clinical one, and sometimes we can go for the NCV or EMG, that means the study of the nerves which supplies the upper limb or lower limb is done to know the types of the nerves affected and what are the different nerves which are affected. Once the diagnosis is made, the treatment becomes little easy. The first and foremost important thing in a diabetic neuropathy is the control of blood sugar level. If there is a good control of the sugar, then the chances of getting neuropathy delays or decreases. If the neuropathy has developed, then we start some nerve tonics, the drugs which affects the nerves, which strengthens the nerves. Okay, once that drug is given, the nerve starts regenerating and the neuropathy can be controlled. In few patients, both of these things, if the neuropathy is not getting controlled or the symptom doesn't get down, then we go for something called as dry needling. So we put different needles on the whole of the lower limb or affected area, which acts on the nerve receptors, and then it indirectly helps in controlling the neuropathy. Another treatment, if all this treatment doesn't work, then there is something called as lumbar sympathetic radio frequency ablation. All the lower limb nerves collectively goes from the spine. This goes in front of the spine, that is called as lumbar sympathetic chain, and we do radio frequency ablation of the lumbar sympathetic chain, which controls the diabetic neuropathy. This is a daycare procedure. Apart from this, there are two other therapies. One is spinal cord stimulator, which is done in the very severe diabetic neuropathy, and intrathecal pump if the spinal cord stimulator fails. So overall, considering the advancement in the medical field, the diabetic neuropathy can be controlled with either of these options. Thank you, dear friends.